necessary information. And then sign the order. The ED staff now await the arrival of Shodney and the transport team.
So now back in the ambulance, the paramedics are still providing interventions, and let's go through some of these. So they're going to actually do a blood glucose. They have partnered with the healthcare system here, so they're actually going to draw the labs for the hospital for stroke patients. So they just will hand that bag back to the laboratory upon arrival, shaving off additional 10 minutes. So I'm going to draw my labs. I'm going to get 12 lead EKG. I'm going to send that to the facility as well. Knowing that she's a possible candidate for TPA because we know the onset, I'm going to start some vascular access, get her on some oxygen. I'm also going to start the TPA checklist so I can send that to the facility as well. So we arrive at the receiving facility. We meet the stroke team at the ER doors. We are not stopping at the emergency department. We are wheeling the patient directly to the CT scanner. From there, we're going to put her on the CT bed, and they'll start the imaging, and we'll transfer care to the stroke team. She's already been pre-registered. Orders are in solution, and then at that point, we're going to go back to the ER. I'm going to get a copy of the phase sheet, okay? Now, we could also scan the patient's barcode on their wrist, but what this is going to allow us to do on the pre-hospital side is connect this record, everything we've documented, so it goes directly into the Epic EHR. So I'm going to click Facility Barcode Scanner. And what that's grabbing is the member number and the counter number. So that's the key that we link the records back. Now I know what most of you guys are thinking is every hospital's barcodes are a little bit different. The built-in utility can be designed for each receiving facility, so you don't have to have multiple different tools or external wireless Bluetooth. It's all built into the solution based upon what destination you chose. So the paramedics are going to finish up their documentation. They're going to finish up, post the record to the cloud, and it's going to be sent directly into the EHR, and the hospital's going to continue treatment with that.
So, after completing her imaging procedures, Shodney is taken back to the emergency department. The ED physician reviews the imaging and laboratory results, as well as the EPCR and CCD and CDA file. So I'm going to open the Care Everywhere activity, go to Documents, and as you can see, we've received the two documents. I'll start with the EPCR. As you can see, we've received all this information from the paramedics. Going back to the Care Everywhere activity, I can open up the CDA as well. After consulting with Shodney's daughter, the decision was made to treat her stroke with IV thrombolytics. The ED physician enters the order for IV thrombolytics in the patient's electronic medical record, and via smart pump interoperability, the order will be sent to the infusion pump.
So with infusion pump interoperability, we are able to automate the infusion pump programming to make sure all the rights of medication administration are being selected. Remember to standard practice of barcode medication administration, or BCMA, to make sure we have the right patient, the right drug, and the right medical device. So by scanning the Novum IQ pump's digital on-screen barcode, we identify the pump to achieve device association with the EMR.
After reviewing the association information and confirming it in the EMR, the infusion order can now be wirelessly sent to the pump. Nurses no longer need to manually key in every character of the infusion order, which saves them time and helps ensure medication administration is accurate.
So in real time, the pump receives the infusion order, and the important infusion order parameters are already pre-populated on the device. So I no longer need to look for the drug in the pump drug library or enter the dose number by number. So as you can see, the pump has received the medication the doctor ordered for Shodney, multiplace. So I will accept the order. And this medication requires a loading dose. So the Novum IQ pump automatically prompts me for the loading dose, so I'll say yes. And you see the weight, the time are already pre-populated. So I'll just confirm. And now I will review the primary infusion. As you can see, the weight, the dose, and the volume to be infused have been received from the EMR. So I'll just say yes and accept the program. And start the infusion. So the loading dose is now infusing, and in a minute it'll be complete. When it's done, the pump will automatically switch to the primary infusion. So now that the pump is associated with the patient record and her infusion orders, any infusion events and all infusion status information will be automatically communicated to the EMR via HL7 messages. So this makes nurses' job a little easier and accurate. So their job can be more accurate and quick to associate the patient and their infusion administration in the EMR.
For example, the loading dose started at this time. The loading dose completed both the complete event and the change in infusion rate was sent automatically to the EMR. Clinicians save time, but also the whole care team now has access to information such as medications administered and fluid volume inputs to better inform Shadi's care. Upon successful administration of the IV convalescence, her physician reviewed the infusion data. Shadi's timely acute care intervention significantly improved her condition, and as her stroke symptoms resolved, she was transferred for rehabilitation and ultimate discharge. So I'll go back to the ED manager, click on our patient, hit the discharge button. I'll need to fill out the current date and time, discharge disposition, and hit discharge. Upon discharge from the hospital, information about Shadi's hospital stay is sent back to the paramedic agency via an HL7 AO3 discharge message.
So the EHR automatically sends the outcome data for Ms. Patel's case back to the paramedic agency, where they're going to perform CQI. We talked about how they were drawing labs on good partnership with the hospitals. That program allows them to identify other areas where they can improve and reduce harm. Meanwhile, at the same time, the hospital stroke coordinator is now taking data from both the EHR and the EPCR and incorporating it in their patient registry system. So this example, this is the Imatran patient registry system. This will allow them to see an entire record from start of symptoms all the way to discharge with rehab to perform quality improvement measures on it. So this is one of the key components to the facility's improvement process. And then data from this registry ensures the hospitals meet national benchmarks. Additionally, once they actually go through this process, they're going to submit that to local, regional, state, and federal repositories for additional analysis. Okay, example would be the CDC's Coverdell. So in summary, the integration between EMS, which is Imatran, the EHR Epic, and the infusion pump Baxter was able to shave off 50 minutes from the patient's arrival to treatment. So think about this. When the paramedics arrived, she was already registered, went straight to imaging. The orders were already placed, labs